Hello everyone, welcome back to my channel. In this video, let us see medical surgical nursing important bits. So first question is, in a patient of stroke, dexamethasone is administered to increase intracranial pressure, reduce intracranial pressure, increase renal blood flow, decrease renal blood flow. And the answer is reduce intracranial pressure. Next one. The nurse can best prevent foot drop for the bed rest client by the use of traction, cradle, splint, railings. And the answer is splint. Next. In a lumbar puncture, needle must be inserted into subarachnoid space, sinuses, in bone, pia mater. And the answer is subarachnoid space. Injury to which part of the brain is particularly likely to cause death? Cerebellum, pons, medulla, hypothalamus. And the answer is medulla. Which one of the following antimicrobial drug is suitable for the treatment of both tuberculosis and leprosy? Isoniazid, rifampicin, aminosalicylic acid, streptomycin metastasis. And the answer is rifampicin. What may cause a person's ear to get hurt during takeoff or landing of an aircraft? Stretching of the tympanic, damage of ossicles, increased production of cerumen, tear in tympanic membrane. And the answer is stretching of the tympanic. Dysphagia refers to difficulty in breathing, difficulty in swallowing, difficulty in speaking, normal red blood cell production. And the answer is difficulty in swallowing. Next, fever can cause which of the following problem? Fluid loss, hypernatremia, hyponatremia, hypokalemia. And the answer is fluid loss. In which of the following condition the client will have flushed dry skin? Edema, shock, hypervolemia and dehydration. And the answer is dehydration. One of the most common complications of myocardial infarction is hypokalemia, hyperkalemia, cardiac enlargement and cardiac dysrhythmia. And the answer is cardiac dysrhythmia. Myocardial infarction, cardiac dysrhythmia. While a pacemaker catheter is being inserted, the client's heart rate is dropped to 38. The drug the physician would order is atropine sulfate, digoxin, procainamide and lidocaine. And the answer is atropine sulfate. Which of the following is also known as lethal dysrhythmia? This is repeated questions you can see in many question papers. A. Atrial fibrillation, sinus tachycardia, ventricular fibrillation, second degree heart block. And the answer is ventricular fibrillation, lethal dysrhythmia. Which one of the following is the smallest gland of the body? Pituitary, adrenal, thymus, pancreas. And the answer is pituitary. Mixed edema is disorder produced due to hypersecretion of thyroid, pancreas, renal, liver. And the answer is thyroid. Sorry, the option D is wrong. Liver it was. Which of the following hormone is secreted by the uterus for the implantation or in order to fertilize ova? Estrogen, prolactin, progesterone, HCG, human chorionic gonadotropin. And the answer is estrogen. Lungs have numerous alveoli for increasing surface area for gas diffusion, increased volume of inspired air, keeping lung in proper shape, and no specific reason. And the answer is increasing surface area for gas diffusion. Asthma is caused due to spasm in the bronchial muscle, spasm in chest wall, spasm in cardiac muscle, none of them. And the answer is spasm in bronchial muscle. The most frequently occurring type of tumor is glioma, melanoma, Wilms tumor, adenoma. And the answer is glioma. The lifestyle factor of a patient with colorectal cancer includes a low protein intake, high carbohydrate diet, high fat, low fiber diet, a diet low in vitamin C. And the answer is a high fat and low fiber diet. Installation of drug in eye is known as topical, injection, inunction, insufflation. It is topical. Timolol malate, that is beta adrenergic blocker, helps to control glaucoma by dilating the pupil, constricting the pupil, reducing aqueous humor formation, or increasing the aqueous humor formation. And the answer is reducing aqueous humor formation. The most important symptoms in cataract would be loss of vision, farsightedness, no vision in light, blurred and hazy vision. And the answer is blurred and hazy vision. The most common site of cancer is vagina, fallopian tube, cervix, fundus. And the answer is cervix. After a mastectomy, what instruction should be given by a nurse to the patient? Options: how to perform a breast examination, follow-up visits with a physical therapist, referral to reach for recovery group, return to physician for monthly self-examination. And the answer is how to perform a breast examination. Chest physiotherapy is primarily done to mobilizing secretion, dilating the bronchioles, expanding the chest, providing humidification. And the answer is mobilizing secretion. Which position gives a maximum air exchange? Supine position, orthopnic position, high follows position, semi follows position. And the answer is orthopnic position. Complication associated with tracheostomy tube insertion includes pneumonitis, respiratory distress, pneumothorax, laryngeal nerve damage. And the answer is laryngeal nerve damage. A cataract is an opacity of the lens, a band in the lens, degeneration of the lens, crystallization of the pupil. And the answer is opacity of the lens. The contraction of the ciliary muscles, which will close the eyelids, causes the pupil to dilate, focuses the lens on near object, brings about convergence of both eyes. And the answer is focuses the lens on near object. The treatment of choice for malignant melanoma of the eyes is radiation, enucleation, cryosurgery, chemotherapy. And the answer is enucleation. Physiologically, the function of the middle ear is to maintain balance, translate sound waves into nerve impulse, amplify the energy of sound waves entering the ear, communicate with the throat via the eustachian tube. Middle ear function, answer is amplify the energy of sound waves entering the ear. In Meniere's disease, what drug nurse expect from the physician? Vasodilator, vasoconstrictor, and diuretic. And the answer is diuretic. Meniere's disease, diuretic. Which position is commonly given in sigmoidoscopy? Genupectoral, prone position, left lateral, Trendelenburg. And the answer is genupectoral. One of the main source of carotene, leafy greens, potato, pomegranate, oranges. And the answer is leafy greens. Prophylaxis for the hepatitis B includes limiting hepatotoxic drug, screening of blood donors, avoiding fatty diets, avoid milk in diet. For hepatitis B, screening of blood donors. Before ligation of hemorrhoids, the advice would be high protein diet, high fat diet, low residue diet, high calorie. And the answer is low residue diet. At the time of receiving enema, the patient should be placed in left lateral position, right lateral position, knee chest position, lithotomy position. And the answer is left lateral position. The most important method of preventing amoebic dysentery is pesticides control, rat control, sewage disposal, tick control. And the answer is sewage disposal. Hemorrhoids results from constipation, exercise, diarrhea, high calorie. Answer is constipation. One of the main functions of the bile is fat emulsification, protein emulsification, helps in synthesizing the vitamins, carbohydrate digestion, and the answer is fat emulsification. The nurse should administer a nasogastric tube feeding slowly to reduce the hazard of flatulence, distension, regurgitation, diarrhea. And the answer is regurgitation. The breakdown of triglyceride yields which of the following molecules? Amino acid, urea nitrogen, simple sugar, fatty acids. So breakdown of triglyceride, answer is fatty acid. The term saturated and unsaturated fatty acid relates to degree of color, taste, digestibility, density. Answer is density. The hormones secretin and pancreozymin are secreted by duodenum, jejunum, appendix, liver. And the answer is duodenum. The term that refers to lack of interest in food is anorexia, polyphagia, dysphagia, dyspepsia. And the answer is anorexia. So that's all for this video. For part 2, please like, share and subscribe this video.